Individuals or people living with HIV shouldn't be isolated in our society. Come on, guys, these people are actually, some of them are victims of circumstances. They actually contacted this HIV probably unknowingly from an unfaithful partner, healthcare professionals that got it in the hospital unknowingly, from needle prick, contact with infectious fluids. So some of them are our loved ones, so we shouldn't let them out. What I'm saying is, yes, you can still have something to do with them and still not get infected with the virus. So this is where PEP and PrEP comes in. PEP and PrEP. So please stay to the end of this video. Let's talk about that, okay? I'm trying to test my microphone. Microphone testing? 2, 3. Okay. Fake. You got this, okay? Stop this rubbish you're doing. So let's go. HIV stands for Human Immunodeficiency Virus. Now, this virus tends to attack our immune system, that is our body immune system. Take note, HIV is a living thing only when it's inside a host. Outside a host, it cannot survive on its own. So, HIV actually needs a host, as in a human being, to survive. Now, when HIV gets into the body, this is what it does. It attacks your body immune system. That's why I said HIV is a human immune deficiency virus. It attacks your body system. So now, when HIV comes into your body system, what does it do? It goes straight to your CD4 cells, that is your helper cells, and destroys them. Now, how does it do that? First of all, when I talk about these helper cells are your immune cells, like your immune cells. So it's like an alarm system. When for example, your 911, when you're sick, you call 911. Well, actually, that's not happening in Nigeria, but when you're sick at home, you can call your mom. They take you to hospital, or probably they bring first aid. It's just like that first contact. So immune cells, helper cells, that's what they do. They are there to fight against any virus or any infection that comes in your body. So, but what HIV does is that HIV has this mechanism that when it comes, it goes and attaches itself to these CD4 T cells, like the helper cells, and then uses it to replicate itself. And it does this, and as it's replicating itself, it's killing the CD4 cells. So now, imagine when HIV does that and it continues to kill your CD4 cells, and your CD4 cells keep going down and going down. That's when you know that you're down with HIV. So there's what we call window period. Window period is the period between exposure and then the period between tests, when you test positive for HIV. So this is the period when HIV does that, like it tends to kill your CD4 cells. That's the window period. That's what it's doing at that particular point in time. So the normal CD4 cell a human being should have is between 500 to 1,500 cells per millimeter cube. But if HIV comes in contact with you, or you are being exposed to HIV, and then it continues to kill your CD4 cells, and you have a CD4 cell that is less than 200 millimeter per cube, then my dear, you're progressing to something they call ACE, which is acquired immune deficiency. And also, when HIV continues to kill all those CD4 helper cells, it's kind of like gives room for other opportunistic infection, because it's just like when mom is not at home, dad is not at home, nobody to protect you guys, and you guys are just probably 2 or 3 years, 4 or 5 years. Anybody can come in at any point in time and do anything to you guys. So that's when opportunistic infection comes in. So let's boil down to the stages of HIV. HIV has actually 3 stages. We have the acute stage, the chronic stage, and AIDS. So the HIV progresses through the stages as your CD4 cells retrogresses. You can only know about this by what we call the viral load. Now, what is a viral load? Viral load is actually a test that is being done to know the amount of HIV in your body, and it's being measured in HIV virus cell per millimeter of a fluid, that is blood, being measured. Now, the normal viral load that you can have, and you can say that you have a low viral load, is what is between 20 to 75 millimeter of HIV virus per fluid. And when you have a low viral load, you can actually know what transmit HIV virus when you have a low viral load. So this boils down and brings us to PEP and PrEP, which is our main topic. So let's start with PEP. PEP simply stands for post-exposure prophylaxis, and this is a medication or a drug that can help to prevent HIV from entering into your body. But you know what? This drug can only work just 3 days after exposure. That is 72 hours after you must have contacted HIV. This drug can only work within that period. So if you have contacted HIV and you didn't take this drug within 72 hours, probably you took it the fourth or the fifth day, sweetheart, I don't know about that. I'm not sure it's not gonna. I'm not sure it's going to work. But the earlier the better. So if you have been exposed to HIV and you take this drug within 72 hours, then just be rest assured that you have a chance to do what? To not get infected with the HIV virus. So now, this particular drug is a 28 days course. That is 4 weeks. So you have to be taking this drug every morning, like for the complete 28 days. After taking this drug for 28 days, then you have to do what? Go back to where you got this drug from. I'm still going to tell you where you can get this drug from. You go back to where you get this drug from and then do what? Have a test again for HIV virus. So when you test negative, then you know that what? You're free from this virus. Then you can stop taking this drug. Now, where can you get this medication called PEP? PEP is actually being distributed worldwide by UNICEF and other organizations that are trying their best in every possible way to stop the spread of HIV virus. So you can actually get this drug from federal hospital, a general hospital, community health center. They are all there, and they are free. You don't have to pay for it, okay? So you can just go there and get them. Don't keep on the hideouts. Don't hide yourself because you got exposed. The earlier the better. The earlier you get this drug, the better for you. If you hide yourself, sickness is going to hide you. That's what is being said. So the earlier you get this drug from these health centers, community health, or probably a sexual health clinic, the better for you. So now let's talk about PrEP. PrEP simply stands for pre-exposure prophylaxis, and I know probably by now you'll be thinking, what's the difference between PEP and PrEP? PEP is actually taken in emergency situations, like you've been exposed and you didn't know you were exposed and you didn't know it was accidental. You take PEP, but PrEP on the other hand is for the strong-hearted, like you have plans of being exposed. So you take PrEP, which is pre-exposure prophylaxis. Now, this drug has a 99% chance of preventing you from contacting HIV virus prior to what? Exposure. A quick disclaimer, I'm not encouraging anyone to have sex or to go ahead and have sex with a HIV carrier, but this is life actually, and life is truly fickle. People have their decisions and their choices, and life happens. So, this particular drug, pre-exposure prophylaxis, actually is being distributed same way PEP is being distributed. You can get it in health center, general hospital, federal hospital, a sexual health clinic. Now, how does this drug work? This drug comes in various composition. We have a type called Trovida, we have the Discovery, and many others. But these are the two I know that is being recommended by Food and Drug Administration US. So there are many other brands of it. There are many of it, but if you want to have them, you have to consult your healthcare professionals first. Why? Now, this drug is not anybody that can take PrEP. Before you start taking PrEP, you need to run some tests. Because if you go ahead and start taking this drug without your healthcare professional, you didn't consult your health practitioners, you can probably start having signs and symptoms like headache, nausea, rashes, or probably you start losing your bone mineral density. You can start having liver damage, or probably kidney failure at long run. When I mean long run, means that you've taken it for a very long period of time. So this drug is being taken with caution and test management. You need all those stuff to carry on with this particular drug. Now, for you to take PrEP, you have to take this drug actually needs time. So you can't just take this drug today and then you go and get exposed. You need to take this drug for about 7 days, and then before exposure, and even after exposure, you also take this drug continuously. As long as you're with a HIV partner, you will continue to take this drug. Unless you stopped contact with a HIV carrier, a HIV partner, then you can stop taking this drug and you can right away go check up, that is, run some tests again and consult your health practitioner. So you take this drug. How do you take this drug? You take this drug daily, that is once daily. But before exposure, make sure you've taken this drug 7 days before exposure. That is 7 days before exposure. Then after the 7 days, you can now you can now be exposed. You can now go ahead and get exposed. And even after exposure, you have to continue taking this drug daily, that is every morning, until you are out of your exposure. That is, you are out of your exposure, out of your partner, then you can stop taking this drug. But just know that you need to run some tests. You can't just go ahead and take this drug you can't just take this drug anyhow. You need to consult your health professional, your doctor, in order for you to take this. I also want you to know that you taking PrEP does not prevent you from contacting other sexual transmitted disease or infection. It can only prevent you from contacting the HIV virus in particular, but it doesn't prevent you from contacting other STDs, and also it doesn't prevent you from getting pregnant. So it's just a HIV drug. It was just meant for that. So if you've gotten to this length of this video, then I probably guess that you must have learned a lot, because we talked about HIV, its stages, that's acute, chronic, and A stage. And we also talked about what the window period is, viral load, PEP and PrEP, which is post-exposure prophylaxis and pre-exposure prophylaxis, what those medications are, how you can get those medications, how to take those medications, and also cautions to note as you take those medications, because I mentioned the signs and symptoms also. So please, if you're made it to this video, please like, subscribe, and share our video, and also hit that bell for notification as to know when we are dropping our next video. Bye.